This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
According to the Department of Health, almost 2 million Filipinos are suffering from low vision, 41% of which is caused by cataract.
Everybody would get a cataract. Cataract is an aging change, so all of us will really get a cataract when we get older. It doesn't give you pain. The eye will look just basically like a normal eye, but for the person with the cataract, it's a progressive blurring.
It is more common among people aged 60 and above. Cataract can also affect young people, just like what happened to Russell. At age 1, a form of cataract has already threatened his eyesight.
At first, there's no problem. Not until 7 months, Dr. Chua noticed a 4mm spot that could lead to cataract. And it was found out that the cataract has developed, covering all of his iris. I was shocked. I was quite depressed because of all people, my child.
Russell was diagnosed with developmental cataract, a kind of cataract that refers to lens opacity present at birth or the clouding of the eye's natural lens. It covers a broad spectrum of severity. Whereas some lens opacities do not progress, others can lead to permanent blindness.
He will just remove the cataract and then put another lens. But my fear then is the procedure.
After Russell's successful operation, he now has to use corrective eyeglasses to help him rehabilitate his affected eye. What are the factors that cause cataract? What are the complications of this eye disease? What are the medical breakthroughs in treating cataract? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Richard Nepomuceno, cataract and refractive surgeon from the Pacific Eye and Laser Institute. Also with us is Dr. Zita Meriales, ophthalmologist and cataract and glaucoma surgeon from the Makati Medical Center. Good evening, doctors. Welcome to the show.
Good evening. Yes, good evening.
Doctors, what is cataract? Is it a disease? Is it a condition? Is it genetic? Is it acquired?
Well, cataracts, it's the clouding of your lens. The lens is important because it focuses the light on your retina. So if it clouds up or it gets some opacities, it blocks the light, no? So it's not functioning well. So you may consider it as a disease also. Okay. So causes, it can be congenital. For our case, can be congenital or it can be acquired. No?
So almost all of the above.
Yeah.
It's a condition, disease, acquired, genetic.
So there are different types. So if it occurs at this age, if everything else is ruled out, most probably it's congenital.
Okay. So we mentioned the case study at a year old. He
That's so
already
sad.
yes he was already he
That's
had
really
surgery
sad.
already because he had cataract. Was that during her pregnancy or it developed shortly after he was born? Dr. Chi?
It could be. It could be while in utero, while inside. Most likely that's how it is, because when they notice it's already a little bit big, 4mm.
With children, it's a little special, unlike in adults, because it's not just removing the cataract. You saw the child, he was wearing eyeglasses.
Yes.
So it's also, you rehabilitate a child to see. So it's very important that they're able to see clearly before the age of 7 or before the age of 9. So even developmental milestones, it includes the vision of or fixation, and then you have to teach the child to see. So it's very different for children after the cataracts are removed.
So with the surgery, with Russell already wearing glasses, will his vision be normal, just like all the other kids his age?
Well, there's several factors. One, was it affecting only one eye? Because the other eye will always be the dominant eye. So it will always be a weaker eye. And you have, as I said, you have to teach this eye to see. There's some training, no? If it doesn't see clearly to begin with, it will not see clearly when he's older. So sometimes you'll see some children, they patch the eye to train the poor eye to see. So you're training it. And then you have to change your eyeglasses regularly because the eye is growing like the child. So it's a commitment on the parents' part. It's very important because they're really part of the treatment if it's a child. It's not just the doctor. The parents should be all out support.
And just like what his Russell's mom is
because
doing.
Because the child will throw the eyeglasses away.
Not used to it.
And then if they cover it, they'll get mad at you. So
yes,
it's really persistence in treating these cases.
So how about in adults, Doc Richie? In a child, you have to train the eye when one has undergone surgery to remove the cataract. How about for adults? Is it the same case, or how is this different from that of a child's experience?
For adults, not so much anymore because they pretty much had years of using the eye and it just degenerated as the years go by. So after that, they're pretty much good to go.
Okay. So you mentioned degenerating. The eye has degenerated. How does the eye get to that stage? Our VTR mentioned that 60 and above do suffer from cataract. So how does the eye degenerate?
Well, inside the eye, it's pretty much like a camera. So you have a lens inside. And as you grow older, the composition of the lens changes. So from being transparent, it slowly becomes opaque. So, and then the vision gets cut off because the light can't go through. So that's what the changes that occur inside the lens.
So these changes are brought about by genetics, as we mentioned earlier. Genetics,
maturation,
morph-aging,
aging, really, and we can't stop aging. So we're all bound to get a cataract at some point in our life as we age.
Yep, if we live long enough, yes.
Genes will really play a part. If you have very good genes, you just hope that the maturation process will be kinder on you.
Maybe kinder means slower, or you don't get it.
Yeah, well, everybody sooner or later will get a cataract. So you just hope that it will be slower, kinder. You just like to age gracefully. So those are some of the things you have to consider.
Since you can't
it will
avoid
happen.
having it. How about the signs? Let's now go into the signs and symptoms that will alert the individual that there is a formation of cataract already. Dr. Richie, start with
Well, number one is the blurring of their vision. So despite the eyeglasses, vision is still not as good. Sometimes at the onset, you can have a little bit of glare when you're driving at night.
Yeah.
That type of thing.
Okay. What other signs and symptoms? Glare.
Glare, yeah.
Sometimes maybe people might attribute that to being tired, and they might think that glare is just because they've used their eyes the whole day and that their eyes are very tired.
If you think about it, it's true because the cataract as it ages doesn't focus as well as when you're young. It's supple. When you're older, it's stiffer. Focusing can be an early sign also, but it doesn't mean that you have to do something at once, no? But focusing problems when the lens stiffens, the lens changes in color, or there's some opacities that happen within. So those are some. And if you expect glare when you drive at night, because the opacities in the lens breaks the light apart. So that's the reason why you get glare.
So glare, that's one sign, one symptom. What other symptoms should we watch out for?
Well, if you cannot see well with your glasses, I think you should have it checked.
How about one who doesn't wear glasses but who suspects of blurry vision or that the opacity has been blocked already?
then usually the vision is worse.
Yeah.
Okay.
It's darker already. Actually, sometimes they just don't complain. They're used to it,
Yes.
you know.
Yes.
But you'll notice that for elderlies, we have to be very careful, no, when they walk out, because it's a risk for falls, for falling injury. So because depth perception will be very difficult. So like going down the stairs, that's a problem. So if you notice that your lolas or lolos are having a hard time going up and down the stairs, and it's not because of their knees, then you might want to have their eyes checked. Or if you tell them to look far and they're not seeing well, you might want to have them checked. Or if they're bumping into things already. So those are some of the signs. These are very, very advanced.
Obvious or advanced signs.
But you know, if it's your lola and lola who do not complain, you notice they're having a hard time going up and down, they're bumping into things, I think you should bring them to an eye doctor.
We talk about lolo and lola, so
Yeah.
we assume that they're in their 60s. What about those who are in their 40s? They say when you're in your 40s, you already have to have or you must need glasses already. Will that also be an indication that there's cataract forming?
Well,
Dr. Chi?
ideally, everybody should have a regular eye checkup every year, regardless of age, to begin with.
At what age should we start doing that?
1 year old, 2 years old, you're supposed to bring them in.
For this case, yes, because you presented the child before they go to school.
Okay, so every year thereafter.
Every year. It's pretty much like your annual checkup for work. It's something that should be done for your eyes. Dentists are seen every 6 months.
Yes.
Then your eye doctor should be seen at least once a year.
Okay.
Well, 40 is a good age.
40 is a good age to
Yeah.
start, if you haven't started when you were younger.
Yeah, and for the pediatric cases, the
Yes.
pedias are, they're trained to detect lens opacities. So that's part of the milestones that they will look for. So, and then before they start school, they should be sure that their vision is adequate for their age. So they don't have any lazy eyes.
We'll talk about more of the signs and symptoms of cataract, but first we have to go to our Facebook question, doctors. If I decide to have cataract surgery, does it mean that it will not recur in the future?
Yes, it won't recur. Once you take the cataracts out,
It's gone.
you won't grow it back.
Oh, really?
It's gone.
It's gone forever.
It's gone.
Oh, okay. So is there any benchmark or is there any size as to when you should have the cataract removed?
The when comes in nowadays, it should be that if the patient is already having some difficulty with his vision and the cause is a cataract, then that's the time that you have the cataract removed. You don't have to wait until you can't see a thing anymore. That's how they used to do it, but not anymore.
Your vision should keep up with your lifestyle. So if you work a lot, everybody needs to work. There's a lot of things to do, so your vision should be as good as how you want to live. No? So they want to have it removed because there's glare, especially for that glare thing at night. That's
Yes.
quite bothersome for people who drive always at night. So for them, it may not be, for others, it may not be that thick yet or mature yet, but if it bothers you and it disturbs your way of life, you may consider having it removed early.
Okay. Doctors will talk about prevention and treatment and maybe more about the signs and symptoms of cataract when MedTalk returns.
Did you know that the oldest patient to undergo cataract surgery is 109-year-old Guo Lansheng from China? After 10 years of poor vision, Guo Lansheng's eyesight has been restored, setting the new world record for the oldest cataract surgery patient, according to the World Record Academy.
We are back here on MedTalk, still talking about eye problems. Cataract is our main topic for tonight. We've talked about the signs and symptoms. Let's now go to the prevention and treatment. So what kind of treatment or what kind of surgery will one undergo if one wants to have their cataract removed?
You know, once you do have a cataract, the only way to treat it is to remove it, and you need to replace it with a new lens. Okay. So generically, we call it cataract surgery. So
no eye drops can soften it and make it again supple.
No.
Not really.
You
no,
can massage.
no.
No.
Yeah.
No, unfortunately not. It really you really have to undergo
If
surgery.
it has to go, it has to go. And fortunately for us, cataract surgery has evolved tremendously since the time of our first ophthalmologist, Dr. Jose Rizal. Since his time, it really evolved.
Long time ago?
So,
Very
yeah.
long time ago. How has it evolved? How has it changed? And what are the new modalities for that?
Okay, historically, Jose Rizal treated his grandmother because his grandmother had cataracts. He waited for it to really turn white, and he just pushed the eye of the grandma to dislodge it and make the cataract fall back. That's what they used to call it couching, and it's a recognized medical or surgical procedure before. But you wouldn't want that now.
No, I don't think
it really has evolved, and eventually they would incise the eye. They had bigger wounds. We had bigger wounds before, about maybe 10, 15 years ago. We had the regular cataract surgery. We had a big incision, take out the whole lens entirely and replace it. But now we have better lenses. We have smaller incisions, so you get to go back to work faster. Unlike before, you had to sit still because they had no sutures. They had no proper sutures before, so they would put sandbags, so the patient won't move. Okay, then eventually sutures develop, so they're able to close the eye. But now, no sutures again, but very small incisions. You're back to work as soon as you're done. Well, you just wait a few days. It depends on what your work is, actually. That will guide us when to send you back.
You mentioned, Dr. Chi, the lens, changing of the lens. Briefly, what exactly is this? What happens to the lens of the eye? What changes?
Well, like I mentioned earlier, the transparency of the lens changes, becomes cloudy. So you're going to have to take out that part, that lens, and you replace it with a new one that's still clear. So, and there are different kinds of lenses now. There are some that are basic lens. Then there are lenses that can take care of your astigmatism. And there are lenses that can give you distance and near vision again, just like when you were in your 30s, for example. So there's a lot of technology out there in terms of lenses.
It's very nice, actually, now.
And nothing to be afraid of.
Well, surgery is still surgery.
Okay.
So it's still a major decision. The technique now is very beautiful, if I would like to say so, because small incision, then we have these lenses that you fold into 3, and you just inject it into the eye, and it unfolds. So it's really, it sounds so elegant.
Yes.
But surgery is still surgery. It's still a mutual decision between you and the patient, because there's still some problems that can occur with surgeries. So, but the technique now, it really has evolved. We're much luckier now than our lolas. Yeah.
No one has to push your eye
no more
and wait for it to drop. No more.
No more. We don't have to wait for the lens to really turn white before we do something about it.
And as you said, it's beautifully done.
Yes.
It unfolds.
It unfolds.
Right before our very eyes, so to speak.
No, well, you won't see
your
it.
eyes as a doctor.
But you'll see it.
You'll
see it. It's a very nice procedure nowadays.
And speaking of being a nice procedure, and it has evolved, and how about the information given to all patients out there to have their eyes checked regularly? Because we don't really hear much about people, I'm going to my ophthalmologist to have my eye checked. Why? What's wrong? There's nothing wrong. I just want to check.
Actually, thank you for that opportunity, because we really want people to have their eyes checked. And it's not just because of cataracts. It's not just because of eyeglasses. Well, glaucoma, my specialty is glaucoma, so in that one, it's a silent disease. A lot of times you don't see or feel anything until it's too late. So it's
We
really...
can have that next time.
Yeah, well, yeah.
Talk about
Well,
it, yes.
it's really important because you don't feel anything. So at 40, when you said when is the best time, maybe 40 is a good benchmark. Just have your eyes checked. And if you get a good bill of health, then
You're okay.
you're okay. Peace of mind. That's at least for glaucoma anyway, because that's our goal. We're part of the Philippine Glaucoma Society, so one of our goals is to encourage people to have their eyes checked, make sure that they don't have any blinding disease.
Anything that might blur their vision.
Yeah.
Because we don't realize the importance of our eye or our eyes not until, you know, there's this blockage or we can't see anymore, we can't read anymore, we can't watch our favorite shows anymore.
Oh yeah.
That's the only time that we get them checked. So the importance, we've mentioned the importance of getting our eyes checked, of being more conscious, being more vigilant, so to speak,
Yeah.
about the condition or the health condition of our eyes. How about, is there any type of food that we should eat? Are there drops to take care of our eyes on a daily basis? It's just like brushing your teeth, take care of your teeth, you brush your teeth every day. How about for our eyes?
Well, health-wise, if you're diabetic, that's one of the diseases that will affect your eyes. So you have to take care of your diabetes, make sure it's well controlled. No? Also, smoking is a problem for the eyes because there are several eye diseases that have been related to smoking. So if you can
Lessen
that as much as
stop it.
possible, stop it, then it might help. I think general good healthy lifestyle will do. Low maintenance, as long as you have it checked.
Okay.
Yeah, ultraviolet ray exposure
I was
is
about
also
to ask that. Yeah. What about those who work and are exposed to ultraviolet rays? How can they protect their eyes?
They're supposed to have
They're
safety
best.
goggles, protective goggles. If their exposure, I'm sure they will know about it in their workplace. They would be advised to have some safety goggles.
So we talk about the workplace. How about the place? You know, when we go out into the sun, we don't realize that we have to wear our protective eye gear, or shades.
Yeah,
Not for pharma purposes,
Yeah,
but to protect our eyes.
That's
from
true.
Rays of the sun.
Yeah, the best way is to always wear a good pair of sunglasses, the one that really has UV protection, not the ones that are just dark, because some of them are just tinted and they don't
But
really
they don't
have
give you the same protection.
ultraviolet ray coatings.
Okay,
So that's
UV,
actually that's
important.
harmful. If it's just dark without UV protection, that you might be harming your eyes more. So you make sure that there's, and you said activities, sports. We get a lot of injuries from racquetball,
Yes.
tennis, badminton. No? So if you're going to something with contact sports, you might think about
Best to
wearing
wear
goggles. Yeah,
Okay.
especially for badminton, you know,
Badminton,
or
squash,
fast
tennis.
balls,
Yeah.
squash.
Yes.
Because those things, once those things hit your eye, you can have problems.
Let's check out our Facebook question. We go back to our questions, Doctor. My grandmother had her cataract removed. Is 20/20 vision guaranteed after the surgery?
I'd like to guarantee that, but
We usually
I'm not
reach
God.
20/20, but we can't guarantee it.
It can happen.
Oh,
it
yeah.
can happen.
It can happen.
It happens
It
a
can
lot.
happen,
but
you know,
can't guarantee every single time all patients will get 20/20 afterwards.
But how does the patient feel after having cataract surgery? Is it
they're so happy. Well, if barring
is
any
it vision like
problems.
they were in their 30s?
Oh, first color. We take for granted color. Everything is now more vivid. Green is like green, blue is really blue, red. So it's
Rich
really
green,
yes,
very
richer.
rich.
Clearer also. Watching TVs, seeing for the lolas who go to mass, they see the signs. They see the priest. So it makes a difference for them. And then when they go out, they see their they see the faces.
Nice.
So it's quite dramatic, no? For the younger ones, they'll have no more glare. They see better. They can go back to work. They read better. So it's
Drive better at
they
night.
drive
There you go,
better.
drive
It's
better at
safer.
night.
It's safer. It's a lot safer.
Okay. So safer, you drive better quality of
Better
life.
quality.
Definitely better quality of life.
And to see better and clearly is something very important that
When you said the
don't
Lola
realize.
106, and you wonder
109,
why
yes.
did they do it? You know, when you're old, you want to see everything because you're already sitting down. You don't want to be old and then just sitting and not seeing.
yes.
So you just have to make sure that you see because it's quality of life. That's what we want to give.
Okay, and that's what we want to give here on MedTalk. Thank you very much, Doc Richie, Doc Mitzi, for helping us see the value of taking good care of our eyes.
You're
Thank you
welcome.
also.
Thank you.
Thank you
We'd
very
like to
much.
thank Dr. Nepomuceno and Dr. Meriales for enlightening us about how to take good care of our eyes. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on the Solar News channel. This is Angel Jacob. Good night.
Covers a broad spectrum of severity. Whereas some lens opacities do not progress, others can lead to permanent blindness.
He will just remove the cataract and then put another lens. But my fear then is the procedure.
After Russell's successful operation, he now has to use corrective eyeglasses to help him rehabilitate his affected eye. What are the factors that cause cataract? What are the complications of this eye disease? What are the medical breakthroughs in treating cataract? Find out the answers tonight on MedTalk.
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News channel.
According to the Department of Health, almost 2 million Filipinos are suffering from low vision, 41% of which is caused by cataract.
Everybody would get a cataract. Cataract is an aging change, so all of us will really get a cataract when we get older. It doesn't give you pain. The eye will look just basically like a normal eye, but for the person with a cataract, it's a progressive blurring.
It is more common among people aged 60 and above. Cataract can also affect young people, just like what happened to Russell.
And joining us tonight is Dr. Richard Nepomuceno, cataract and refractive surgeon from the Pacific Eye and Laser Institute. Also with us is Dr. Zita Meriales, ophthalmologist and cataract and glaucoma surgeon from the Makati Medical Center. Good evening, doctors. Welcome to the show.
Good evening. Yes, good evening.
Doctors, what is cataract? Is it a disease? Is it a condition? Is it genetic? Is it acquired?
Well, cataracts, it's the clouding of your lens. The lens is important because it focuses the light on your retina. So if it clouds up or it gets some opacities, it blocks the light, no? So it's not functioning well. So you may consider it as a...
At age 1, a form of cataract has already threatened his eyesight.
At first, there's no problem. Not until 7 months, Dr. Chua noticed a 4mm spot that could lead to cataract. And it was found out that the cataract has developed, covering all of his iris. I was shocked. I was quite depressed because of all people, my child.
Russell was diagnosed with developmental cataract, a kind of cataract that refers to lens opacity present at birth or the clouding of the eye's natural lens. It covers